Welcome to another episode of the Outside Broadcast at the Perspective Clinic, Tygervalley, MTN, the lower level, partnership with the Founders Up. Today we're going to speak about a topic that is close to my heart personally, and I think as business owners, close to your heart as well. In studio today, or MTN store today, we are joined by the very exciting Dr. Astrid Sass Hlalele. And today she's going to be breaking down a couple of things about stress management, not just for business owners, but also for employees and mothers and everybody else that has a little bit too much on their plate. So, Dr. Astrid, welcome.
Thank you.
And we are excited to have you here. So I'm going to jump straight into a couple of questions that we have. And then after that, we're going to open it up to a few of the audience members that are here that might have a question or two. Okay, so they can share things from their perspective as well. So how should entrepreneurs be thinking about mental and physical health in the context of long performance?
Sure. That's quite a loaded question you have for me, hey? So long-term performance is all about sustainability at the end of the day and not only productivity. Entrepreneurs should always view themselves as a core asset to their business rather as an optional extra. When it comes to our mental health within the business, creating routines, daily routines for ourselves should be non-negotiable. Routines as simple as taking an adequate break, getting adequate sleep, having adequate nutrition, and having regular movement. That's the most important part. And even with your day-to-day, your short-term goals, they should also be your long-term goals. Promoting regular checkups at your general practitioner, even once a year is more than enough. Occupational health and psychoneuroimmunological studies have shown that chronic stress in the workplace definitely contributes to the increased risk of hypertension, burnout, as well as diabetes. So it's very important. A good entrepreneur will know that maintaining your energy, maintaining your clarity is the best way to sustain yourself.
Wow. You said that was a loaded question. I think that's a loaded answer. So you went into people and use some very fancy words. But it's also good to also give us some context with regard to where those studies come from, because I find that more people are just shooting off the hip. So it's also good to have a reputable person with accreditations and sharing that sources of information there as well. Thank you for that. So from your experience in the practice, what patterns do you notice in entrepreneurs when it comes to stress and burnout?
Sure. I think we all are guilty of postponing, right? And I don't think we do it because we do not think our health is important. We often do it because there's just more urgent tasks that we have to get through on the day. That trumps a general checkup at the doctor, right? But like I said, looking after yourself should be a non-negotiable part. You are that core asset of your business. And I think it's very important not to neglect yourself, The other important thing is all the chronic low stress we have at our workplace, blurred lines between our personal and work life, all of that contributes. It does contribute directly to burnout. So like I said, those small habits that you need to create every day, like taking a break, having a chat with another colleague, being open about mental health in the workplace. It really benefits the entire team so that we know at the end of the day, it's not a discipline problem that I think we have as business owners. It's more of boundary setting when we manage our drive and resilience. Because without that, our health will be hazardous, if we don't have any boundaries, especially when we go out every day and do our thing.
Absolutely. I want to touch on the one thing you mentioned there. You said we tend to neglect the things that we think are important because there are other urgent things there. In my experience in business, we as business owners, we have that habit. We neglect the important to focus on the urgent until the important comes the urgent. Yes. And then we neglect the other important things, and we're kind of on this back foot, and we are stuck in this loop of constantly putting out fires, which just compounds that stress even more.
Correct.
So let's hope that we take some of these warnings seriously as business owners. Sometimes we feel a little bit of an itch here, or a little bit of a pain there, or a little bit of something that putting off because we have a meeting this morning and we need to be on a flight at 6 o'clock this evening for the businesses that are traveling and things like that as well. So we're going to open it up to a few people that's in the audience, but not just, right? There's a few more questions that I want to work through. So how do you see unmanaged stress show up in the body?
Sure. So very subtle. We hardly notice it, right? Until we feel that persistent headache and come really scared. Is it blood pressure? What's happening? I need to make an appointment ASAP. That chronic fatigue coming through, disruptive sleep that you get. All these symptoms together, those are the early symptoms that start. And later on, it can fully develop into mood dysregulation, like full anxiety disorder, insomnia, even irritable bowel syndrome. And that's the time you go to the doctor and want 10,000 CT scans to see what type of gut cancer I have, but it started off so simple, and it was something that was ignored until the end. So, like I said, it's very important to maintain those small habits that you have within your workplace, creating a healthy culture for yourself, taking your break, taking your lunchtime, not overworking, definitely. But I know it's very hard because you always think maximum productivity with maximum time on my hands, but it does bite you at the end, long term.
Yeah, I think those are the direct parts, and there's also some indirect ones as well. So if people are prone to stress eating, for example, or if they're so busy, they forget to eat, and they don't take in proper nutrition, so you also see the weight fluctuation, I'm guessing.
Correct.
So for me personally, I'm going to use this as an opportunity to counsel now. I know I'm a little unprofessional right now, but I think I have chronic sleep disorder. I wake up about 4 or 5 times every night.
Sure.
So I blame the kids sometimes, but I think also as an entrepreneur, it's difficult to switch off.
Correct.
So when you have these ideas, and then immediately before you forget that idea, you must check your phone or write it down so that when you have a gap tomorrow, you can put that in there as well.
Yeah.
So when it comes to routines as well, those are obviously some of the earlier advice that you gave earlier on. So we get those things as well.
Definitely. Routine is the best for predictability and to decrease that nervous system that is just always overworked. You know what to expect. There's a safety net for your health and for your daily patterns. So I think that's very important. That the Friday afternoon you rather makes your routine for the next week than the Sunday well rested you. When you have unrealistic expectation going to the gym 5 times, you think you're going to achieve that on Sunday evening from Monday to Friday, 1.5 hour at the gym. Rather let the Friday you in the situation, create your schedule for the next, that's what I always
Absolutely.
say.
It's about putting those realistic time frames in place. And one day I had a fitness coach that said, the biggest mistake you make is trying to cram all of the good things in one day and use the other 6 days as an excuse to be bad. It's like, and he used a very vivid example, which I appreciate. He said, don't brush your teeth for 5 days, and on Sunday, brush it for 2 hours. And see if that's going to solve the problem. It won't, So how has your medical background helped you with your day-to-day practice?
Definitely think it's a very big contributor to insight. We've got a lot more insight. And I think with our training, we are very much long-term thinkers, doctors in general, and also preventers rather than curates, ironically, So much better to prevent something from happening than trying to damage control at the end. So I think with that regards, having that insight to what can eventually happen with a poor diet, what can happen with it's a sedentary lifestyle, all of those things. We've got the knowledge, sometimes don't always implement it so aggressively because of time, but we at least know what to expect at the end. So I think that scares us a little bit to neglect it in the long run.
Absolutely. What do you think are the early signs that people feel that they're not performing the way they once were?
Yeah.
Even if they think like, Their superiors might be telling them, listen, you're not eating the same numbers, you're not as productive, you're not as excited, you are starting to, withdraw and hold back a little bit. I probably mentioned one or two now, but are there other signs that you would come across when you're assessing people?
Definitely. Most patients will come in, complain about poor concentration in the workplace. That is a very big one. Also, they will complain about just constant fatigue. That's the other big one, and would like me to do their eye and their vitamin B12, etc., etc. But then as the conversation continues, I also discover that there's a lot of disruptive sleep happening within their schedule. So an increased irritability, so much staff dissatisfaction between the two of them because tasks are not being completed as before. The quality of work is lower than it was before. So I think that's the most important thing, from irritability, short-tempered, feeling easily overwhelmed. Those are the very big ones. Persistent headache. Those are the most important one as well. To notice that you've got this chronic low-grade stress, and you're not functioning as optimally as you previously did.
Yeah, absolutely. And I find that, there's a big difference and this is subjective. There's a big difference between male entrepreneurs and female entrepreneurs. There's a big difference between male employees and female employees. There are differences in terms of chemical makeups, hormonal balance, a couple of different things. But even from a day-to-day, and I'm generalizing as well, I'm an entrepreneur, my wife is an entrepreneur, but by the time we come home, in some cases, or a lot of cases, I might have the luxury to kind of dial out and wind down, whereas if you're a female entrepreneur, you might be responsible for making dinner that night as well. You might be responsible for running after the kids. And I'm not saying men are not stepping up in that space. Again, it's just a generalization. I've seen how my wife does that. I have a good husband, by the way. But sometimes I just see that females, they carry a little more in some cases. Yeah. Have you seen an increase in female patients coming in?
Definitely. Very common. Women are much more driven than they've ever been before.
Yeah.
I think they've got a lot going on, from business to studying to children, cooking, husband, not always stepping
cooking
up.
Once a week,
or drying once a week.
Yes.
And that's it. So I think it's very important in your marriage as well, with a partnership, to establish those tasks that needs to be divided early on. You are contributing greatly financially to your household as well as your husband. So there needs to be a little bit of domestic compromise happening as well. So the balance between that domestic and financial compromise always leads to less stress for female entrepreneurs, definitely, but also just an overall happy life. Because if you're not always exhausted, you can actually start enjoying, activities daily.
Absolutely.
Yeah.
And I find that on the flip side of that same question, more and more men are opening up about their feelings of being overwhelmed, their burnout. As men, we were always taught to walk it off or take the punch, or you don't cry. So now more and more men are opening up about the way they are feeling. They're feeling overwhelmed. They're feeling unprepared. So I'm sure that you're seeing an increase in males also coming in.
Yeah, definitely. And when I see a male patient that comes in with a mental health complaint, I think the biggest thing to do is complimenting. Thank you for coming in. Thanks for taking care of yourself. Because very few men actually do it. At the beginning of the consultation, you will have all this physical lists of complaints, thinking he's busy developing a cardiac condition, a heart condition. And at the end of the consult, very hard for a lot of males to come to term that they're actually dealing with some mood dysregulation. There is some depression and anxiety happening, and to also be open to medication, or if not medication, even counseling. That is a bit more harder for males than for females, and I think it's just a societal, expectation of men to be a bit more masculine in that regard.
If my father was still alive, it said the only thing that will fix that is a good strong cup of coffee.
Yes.
Let's talk about caffeine for a second. Because we had a brief conversation before the time, and I can see a lot of people are getting a little bit anxious now because coffee is the legal drug that keeps us sane.
That keeps us going, definitely.
But if we overindulge, that has its own set of problems. Tell us a bit about that.
Yeah, no, definitely. Sometimes I walk into office and I see some of my some of the staff members standing with 2 Red Bulls. And I'm like, what are we doing today? You know, what are we going to do today that I don't know about?
Yeah.
So definitely caffeine causes a lot of anxiety symptoms long-term, a lot of palpitations, that type of thing. Thinking you'll be productive, but that overall anxiety makes you even less productive than you think in the long run, you know? I mean, we have to get a coffee or 2 to get through the day, you know? But excessive use is always a no-go. Yeah.
Absolutely. Thank you. And maybe no thank you. Yeah, I'm only really new this one. So caffeine, it's one of those things, I guess, that we can take in moderation, but like anything, if we overdo it, it could become a bit of an issue. It could become a problem. So how can we as entrepreneurs start implementing some routines and systems that can help us ensure our productivity is still in check, to ensure that our health is still being looked after without our work being taken?
Yeah. So like I said, routine, you don't have to have a perfect routine, just a realistic routine that you can implement into your lifestyle. Like I said, scheduling 5, booking the gym for 5 days a week, you know, on a Sunday evening, very unrealistic. And you have to cancel the reminder that pops up Monday, Tuesday, Wednesday, you know. That's not realistic. Realistic, regular movement means, you know, today I cannot go to the gym. A walk is good enough. Turning on YouTube and doing Pilates for 10 minutes or yoga, that's good enough, you know, for today. So I think being very realistic about your goal setting. Also, same thing with dieting, you know. If you do think you need a dietary advice, more formal dietary advice, there's always dietitians to help you. There's a lot of professionals to help you. But creating that realistic expectation, not preparing meals that takes 3 hours, etc., you know, doing something that is within your ability to maintain and sustain. I think that is the most important part of just sustaining and regulating yourself.
Okay, but in addition to us as entrepreneurs, there are also a lot of leaders in the room, right? Employers. What can they do to create an enabling environment to ensure that these stresses are mitigated without compromising on quality and productivity?
Yeah, definitely. So leaders, they do set the tone for every business. They create the culture. So they have to be very intentional when creating a culture. Even something like praising or praising overwork, you know, that is just bad culture. So that is something that needs to be cut. And that is something that can be done by the leader in the business to normalize taking breaks, normalize people interacting with regards to mental health issues without there being a stigma around it in the office.
Yeah.
Normalize your yearly checkups or health maintenance. Go to the GP for your checkup. You know, don't expect your employees to provide a crazy amount of certificates just because they went for a general checkup. So you need to implement it yourself as a leader so that your staff can definitely start imitating your example, because it's higher productivity at the end of the day when we maintain our health. Loads more time available when everyone is happy in the workplace. If people are happy in a workplace, they love to come to work, you know? So, and that will also cause a decrease in turnover of staff. You don't want to meet someone new every first Monday of the month, you know? So you need to create an environment that's sustainable and that's safe for your employees to actually function in and do their best individually and as a group.
I also found that a lot of organizations now becoming more ergonomical in terms of the furniture they use. I see standing desks now that also has the ability to drop, so if people want to sit down, they can sit down.
Yeah.
I feel that sitting down for a long period also has its negative effects. If it's plastic chairs in some cases, or if it's chairs that doesn't support your back and frame properly, that also contributes, I find. So it's good to see that there are companies that are taking notes of things like these and making sure that they're creating the environment, that ecosystem for people to thrive. We're going to open it up. So we're going to open it up to a couple of people within the room and ask if they have any questions that they'd like answered. So any questions? We won't report you to HR. This, sure. Go for it.
Of course.
Love the conversation so far, Doc. I just want to sort of reiterate, I love the whole comment about the environment. I'm currently reading a book called The Body Keeps Score. And it's so, it starts off with an example of war veterans that applied to go to war. Before that, they had to pass a mental health check, and everybody was fit to go to war. And when they came back from war, the suicide rate, the rate of depression amongst those same men was astronomical. And it just shows that when we put ourselves in unhealthy environments and we follow sort of unhealthy patterns, how that can impact our mental health in such a rapid way.
Yeah.
And I think for many of the entrepreneurs, I think we should take note of quite a few of the tips there. And prevent things rather than afterwards. But thank you so much for the insight in conversation today.
Thank you.
So if there's no more questions, it means that you've adequately addressed everybody's need in the room. But I think in closing, if you could just share one or two things that they can implement today that can make a significant change over a longer, but a shorter term view.
Yeah. So I think the most important thing short term is that consistent habits that you create, the consistent small habits. Implement it. Take your break. Step away from your desk. Take your lunch. Talk to your other colleague. Interact a little bit. Get that adequate sleep. Get that routine going on a daily basis. And then for long-term goals, get that once a year checkup. Especially with the ladies, get that pap smear done. Get that breast exam done. For men, get that prostate check out. Get that yearly general checkup with your doctor once a year, more than enough. Then better one time than no times per year. So in conclusion, I would definitely say all that small, consistent habits is much more superior to extreme effort in a short period of time. So keep on with that small, consistent goal.
Dr. Astrid, Sass, Hlalele, thank you so much for joining us here today. We appreciate the insight and the critical views that you bring. And I hope that we can all implement some of these very implementable techniques, and hopefully we can see the massive result of that business. Thanks to all the businesses that came here today. Thanks to everyone that is listening online. We'll be back next week, same time, same place here at MTN Tygervalley. Until then, goodbye and God bless.